March 1945. A damp Pacific wind drifts across a makeshift U.S. field hospital on northern Luzon. The smell of iodine mixes with dust and burned vegetation, settling over the canvas tents like a silent reminder of the fighting only hours earlier. Inside one of the medical stations, lanterns flicker against thin walls as American nurses open their supply rolls, gauze, clamps, sulfur powder, morphine syringes arranged with practiced calm. A group of wounded Japanese women is carried in by medics. Some are young factory auxiliaries, others civilians caught near a collapsed tunnel where soldiers once hid. Their clothes are torn, their faces streaked with dirt and dried blood, yet their fear is deeper than their injuries. Shoulders tremble, eyes stayed locked on the ground. Every movement of an American hand makes them recoil. For months they had been told that surrender meant torture. They had heard that Americans killed captives instantly. Now, surrounded by uniforms they were taught to fear. They brace for the worst. But instead of brutality, they feel warm cloth pressed gently against their wounds, and everything they believed about their enemy begins to crack, setting the stage for the reality behind their terror. By early 1945, the Pacific War had entered its most desperate phase. Japan's defensive perimeter, once stretched across the western Pacific, had collapsed island by island. American forces, pressing through the Philippines and toward Okinawa and mainland Japan, encountered a battered yet still defiant opponent. Among the most overlooked casualties of this period were Japanese women near combat zones, nurses' aides, communications workers, civilian laborers, and refugees trapped as front lines shifted faster than evacuation efforts. Japan's military culture had long carried the belief that surrender was worse than death. For women, this belief was amplified by civilian defense propaganda. Starting in 1944, Japanese broadcasts warned of unimaginable horrors should Americans capture them. Leaflets, radio programs, and civilian training manuals insisted that U.S. troops committed atrocities against women. Many were instructed to take their own lives rather than fall into enemy hands. These warnings were repeated so often that they became unquestioned truth. By 1945, entire communities were conditioned to assume capture meant certain death. On the other side of the war, American field units operated under a drastically different doctrine. The U.S. Army Medical Department emphasized treatment of all wounded, regardless of nationality. This policy followed the Geneva Convention, which the U.S. had ratified and applied even when fighting opponents who often ignored its principles. Army nurses, serving near the front in evacuation hospitals and aid stations, routinely treated wounded Japanese soldiers and civilians when possible. Their medical files noted burns, shrapnel injuries, dehydration, and infections among non-combatants caught between air raids and ground fighting. Yet while American medical staff followed procedure, they also understood the psychological gulf between themselves and those they treated. Reports from Luzon, Leyte, and later Okinawa consistently described Japanese men and women who refused food, cried uncontrollably, or physically resisted examination out of pure terror. Nurses recorded cases in which women fainted when they realized they were still alive after being found by U.S. troops. Others screamed or curled into defensive positions, convinced that medical tools were weapons. The battlefield environment only intensified these fears. As Japan's logistical system collapsed, many wounded women were found hiding in caves, ravines, or abandoned shelters. When U.S. forces secured these areas, civilians emerged exhausted, hungry, and badly injured, but still convinced they would be harmed. American medics routinely approached slowly, hands raised, to show they meant no harm. Even then, many women refused to be touched. This collision between two worldviews, one shaped by militarized indoctrination, the other by medical obligation, set the stage for countless encounters where fear met compassion. Every documented moment of American nurses treating Japanese female POWs reveals the same pattern: overwhelming terror, followed by quiet disbelief. It is within this historical tension that one incident on Luzon became emblematic of the wider experience, leading directly into the angles that help explain why these women were so afraid, and why the actions of American nurses carried such unexpected weight. Fear among Japanese women was not merely emotional, it was socially constructed over years of wartime messaging. Surrender was portrayed as dishonor that extended to one's family. Women were told Americans had no mercy, and many had witnessed soldiers taking their own lives rather than be captured. Under this cultural pressure, Even minor wounds became terrifying when discovered by U.S. patrols. Their trembling hands and silent tears reflected generations of belief that the enemy was monstrous, creating fear deeper than any battlefield injury. American nurses, however, operated under precise guidelines. They assessed bleeding, checked airway obstructions, cleaned wounds with sterilized water, and applied sulfur to prevent infection. To them, nationality did not matter. Protocol did, though conditions in field hospitals were harsh. Mud floors, limited lighting, supply shortages. Their training emphasized controlled movements and calm voices. For Japanese women who expected brutality, this professionalism appeared unreal, making every gentle touch feel like an event completely outside the world they believed they understood. These encounters did not occur in clean or predictable environments. Fighting across the Philippines created pockets of civilians trapped inside military positions. Tunnels, caves, and farmhouses became temporary shelters. When explosions collapsed these areas, women suffered fractures, burns, and shrapnel injuries. Many were unconscious when Americans found them. Waking up inside a foreign medical tent only deepened their panic. The battlefield's confusion meant their first clear memory after an explosion was often the face of an American nurse bending over them with a bandage, creating a moment where fear collided with unexpected care. The most powerful angle lies in the moral contrast between propaganda and reality. Japanese indoctrination portrayed surrender as fate worse than death. American treatment of enemy wounded contradicted that entirely. This contrast created emotional shock, a moment where belief systems collapsed. Nurses later wrote that the most striking reactions were not from pain relief, but from disbelief that their captors saved them. In these moments, the war's cruelty was briefly overshadowed by an unexpected demonstration of humanity, leading directly into the turning point of one of the most telling incidents on Luzon. The decisive moment came after a skirmish outside a hillside tunnel complex on northern Luzon in March 1945. During the fighting, several Japanese women, part civilian laborers, part volunteer aides, had been trapped when the tunnel partially collapsed from artillery fire. When U.S. troops secured the area, medics heard faint cries from inside the rubble. A small rescue team pulled 3 women out, all injured, terrified, and barely conscious. They were carried to an evacuation station not far from the front. When placed on stretchers, the women clutched their clothes tightly, shielding themselves from imagined violence. One attempted to roll off the stretcher, believing she was being taken for execution. Another kept whispering prayers, convinced death was moments away. Their fear was so intense that medics stepped back to allow nurses who often produced calmer first interactions to approach. Lieutenant Margaret Boyer and Lieutenant Helen McCall, both seasoned Army nurses, began treatment. Their actions followed routine procedure, checking vitals, assessing wounds, preparing gauze and antiseptic. But to the women watching, every motion looked like prelude to harm. When Boyer reached for the first woman's arm to examine a deep laceration, the patient recoiled violently, shaking her head and covering her face. Boyer paused, then slowly placed a folded bandage on the ground where the woman could see it. McCarver poured clean water into a metal basin, letting the sound speak for itself. Their movements remained steady, unhurried, and deliberate. Gradually, the closest woman lowered her trembling hand. The turning point came when Boyer wrapped the first bandage around the woman's arm. Instead of tightening it roughly, she adjusted the cloth with careful precision, supporting the limb gently to avoid causing pain. The woman inhaled sharply, not from the injury, but from the shock of being treated instead of struck. Tears formed, unexpected and involuntary. The second woman, watching this unfold, slowly released her grip on her torn clothing. When McCarver approached with water and gauze, she did not pull away. Her eyes remained alert, fearful, yet no longer expecting death. Moments later, she allowed the nurse to clean shrapnel wounds along her shoulder. Within minutes, the entire atmosphere shifted. The field hospital tent, moments earlier filled with silent terror, now carried a fragile calm. American nurses continued their work with soft voices and measured care. The women, though still overwhelmed, no longer braced for violence. Their transformation marked a quiet but profound break from everything they had been taught. A single moment in which gentleness replaced fear, leading directly into the wider aftermath, echoed across the Pacific. Incidents like the one at Luzon were documented numerous times during the final year of the war. The immediate aftermath often saw dramatic changes in behavior among Japanese women once they realized they would not be harmed. At the evacuation station, the 3 rescued women gradually relaxed enough to drink water offered to them. One, previously unresponsive, attempted to sit up on her stretcher to bow, a gesture of gratitude mixed with lingering anxiety. Nurses gently guided her back down, prioritizing medical stability. U.S. Army reports from field hospitals in the Philippines and Okinawa describe similar experiences. Many Japanese civilians, especially women, entered American care believing they were moments from death. When those expectations were contradicted by real treatment, shock often gave way to visible emotional collapse, sobbing, shaking, or quiet disbelief. Nurses considered these reactions as significant as the wounds themselves, noting that fear complicated medical evaluation. Survival outcomes improved dramatically once proper care was administered. Infection, a major killer in untreated battlefield wounds, was reduced by sulfur drugs, clean dressings, and hydration. Broken limbs were splinted, burns treated with ointments, and malnourishment addressed with controlled feeding. For many women, this was their first exposure to organized, methodical medical care since the war began. American medical personnel documented these experiences in formal unit histories. One entry from a 1945 nursing log noted that Japanese women were astonished that treatment was given without harshness, emphasizing that cultural expectations created more stress than the injuries themselves. Another described a young woman who wept after receiving antibiotics, insisting she never imagined an American would save her life. This contrast extended beyond the individual tent or station. When word spread among local civilians that Americans treated wounded women humanely, surrender rates in some pockets rose. Civilians hiding in caves on northern Luzon were more willing to emerge once they heard testimonies from those already treated. Although fighting continued fiercely in many regions, these small shifts influenced how operations unfolded on the ground. Yet the aftermath also highlighted the deeper psychological scars left by wartime indoctrination. Even after recovering, many women carried the emotional residue of believing they would die. Nurses reported that some patients flinched at sudden sounds for days. Others avoided eye contact, haunted by the cultural shame of being captured alive. Despite this, moments of recognition when a Japanese patient managed a small smile or whispered a quiet "thank you" became defining memories for the nurses. They viewed these interactions not as political victories, but as rare, human connections amid the brutality of war. These experiences revealed the profound gap between the fear that shaped Japanese civilian behavior and the medical ethics guiding American treatment. That gap, slowly bridged through repeated encounters, built the foundation for the broader reflections that would define post-war understanding of mercy, suffering, and the shared human cost of conflict. In the quiet aftermath of these encounters, a deeper truth emerges about the Pacific War. Fear often shaped lives as powerfully as bullets. Japanese women entered American care believing they faced certain death, only to discover that the enemy they had been taught to dread offered compassion instead. These moments did not end the war, nor did they erase its violence, but they revealed something essential beneath the uniforms and ideologies. Acts of mercy on the battlefield do not erase suffering, yet they shift its meaning. A bandage placed gently on a wounded arm challenged years of propaganda more effectively than any speech. The calm touch of an American nurse disrupted the myth that surrender meant destruction. In those small gestures, humanity reasserted itself where cruelty was expected. These experiences also shaped the post-war relationship between the United States and Japan. Long before treaties, reconstruction efforts, or political reforms, simple encounters in field hospitals exposed civilians to an unexpected truth. Their enemy valued life, even the life of those who had been taught to resist until death. That realization softened the psychological distance between the two nations, making later reconciliation possible. History often focuses on generals, strategies, and decisive battles, but sometimes the quietest moments illuminate the most enduring lessons. In a dim tent on Luzon, amid the chaos of collapsing front lines, the war narrowed to a single interaction: a terrified woman and the nurse who wrapped her wounds. That moment stands as a reminder that even in the harshest conflicts, compassion can pierce through fear, revealing a humanity shared by all who endure war's weight. And in that fragile space, where fear gave way to relief, The legacy of these encounters found its lasting voice, one defined not by hatred, but by the unexpected power of mercy in the midst of destruction. Thanks for watching this video.